Hello, my name is Myla Lopez, and I will be discussing type 2 diabetes for my media showcase. First of all, I would like to discuss the cause of diabetes. Diabetes has two major causes, which are genetics and poor lifestyle habits. Examples of poor lifestyle habits are lack of exercise, unhealthy diets such as a high fat, high sugar diet, and being overweight or obese. The signs and symptoms of hyperglycemia, also known as high blood glucose level, are increased thirst, headaches, trouble concentrating, blurred vision, frequent pain, and fatigue. The signs and symptoms for hypoglycemia, low blood glucose level, are shakiness, nervousness, anxiety, clamliness, irritability, confusion, rapid heartbeat, hunger and nausea, and sleepiness. Hello, Arthur.
Hi, my name is Arthur Augustin Jr. What
What kind of diabetes do you have?
type 2?
What's your regimen?
What do you mean by that?
Do you exercise? Are you on a diet?
No, I just like to take long walks, and try to ease the friction, that I have.
Well, thanks for the introduction, Arthur. Is it okay if I interview you tomorrow with some more questions about diabetes?
I think that would be a great thing to do, and because I want everybody to know that diabetes is no joke, and people think that you can't have it or you can't take it away. You can't take it away. You just gotta try to live with it.
Okay, thank you, Art.
And I'll see you tomorrow.
Next, I will be discussing the treatment for both hypoglycemia and hyperglycemia. For both of these uh, different types of diabetic uh, ketoacidosis, meaning both hypoglycemia and hyperglycemia, you would check blood glucose level 3 times a day before meals, change your diet to a low fat, no sugar diet, exercise, and stay active. Now, the medications for hyperglycemia are insulin therapy, Precose, Glycet, and Metamorphin. The medications for hypoglycemia are Byetta, Victosa. The overall goal of treatment for the first part of diabetes when you first get diagnosed is to lower your high blood glucose level. Long-term goals are to prevent complications. Some people with type 2 diabetes no longer need medicine if they lose weight and become more active. When they reach their ideal weight, their body's own insulin and a healthy diet can control their blood sugar level, which means to say if you have the ability to change a lifelong disease by being diagnosed by pre-diabetes beforehand, you before it is diagnosed as type 2 diabetes, you have a better chance at getting rid of the disease by exercising, changing your diet, and just watching what you eat. That's it. Hello, Arthur.
Hi.
I have some more questions about your diabetes.
Okay.
What kind of diabetes do you have?
Type 2.
How long have you had diabetes?
Probably for like 10 years now.
How often do you check your sugar?
Um, Not regularly like I should, but I do check it, you know.
What medications are you taking for diabetes?
Metformin,
Are you able to recognize the symptoms of a high blood glucose level?
not really. Unless I go to my primary doctor, yeah.
Have you changed your diet since you've been diagnosed with diabetes?
Not really. I mean, I still eat the foods that, you know, that are bad for me, but I try to eat more vegetables and fruit and stuff like that. So, but
What is the hardest part of being diabetic?
well, staying away from the foods that I like, you know. I mean, you know. So that's probably the biggest challenge, I guess, you know.
Has your social So the prognosis of diabetes is that it is a lifelong disease and there's no cure. Um, Diabetes leads to diabetic retinopathy, which is when diabetes damages blood vessels in the retina and causes loss of vision. Diabetes also leads to heart disease, kidney disease, peripheral neuropathy, which is the damage of nerves affecting hands and feet. So, what I would like you all to take away from this video is that if you're pre-diabetic, it is strongly suggested that you change your diet and exercise to prevent the diagnosis of being type 2 diabetes. Because if you are diagnosed with type 2 diabetes, you have to poke your finger 3 times a day before you eat, take medication, and poking your finger is no fun. So, this is the end of my video. Thank you.
Oh, that's good.